Despite decades of progress, HIV still infects more than 1 million people a year, and a vaccine remains stubbornly out of reach. But this year the world's got a glimpse of what might be the next best thing, an injectable drug that protects people for 6 months with each shot. So we've gathered a stack of articles and research on this new drug, Lenacapavir. What we really want to understand is how effective it is, the science behind it, and what this could mean for the future of HIV prevention.
It is fascinating to see these recent trials showing near 100% efficacy rates with lenacapavir.
Wow, near 100%. I read about 2 major trials. One focused on young women in Africa, and the other with a diverse group of men across 4 continents. Both showed incredible results. It seems like Mitchell Warren of AVIAC was right when he said, you don't see data like this every day.
Those trials were indeed groundbreaking. What makes lenacapavir stand out is its unique approach. It targets the HIV capsid, the protein shell that protects the virus's genetic material.
I remember when scientists thought the capsid was undruggable. How did they even figure out how to target it?
For a long time, the capsid was a bit of a mystery. Then researchers began to understand its structure better. They discovered it's both stable and flexible, which allows the virus to squeeze into cells and replicate. Lenacapavir exploits this unique characteristic.
So it's not just blocking the capsid, it's actually messing with its structure.
Yes. Lenacapavir binds to the capsid proteins and stitions the entire structure. This prevents the virus from interacting with cells and stops it from replicating.
That's pretty amazing. Such a tiny tweak at the molecular level can have massive implications. It makes you wonder what other possibilities are out there.
There is another interesting aspect to lenacapavir. The drug is poorly soluble, meaning the body absorbs it slowly. This was initially seen as a drawback, however. It turned into a strength.
Hold on. How did poor solubility become a good thing?
It led scientists to develop an injectable form. And because the body absorbs it slowly, it stays in the system for a long time, providing that 6-month protection.
That long-lasting effect is incredible. I can see why there's so much excitement around this. So what does this mean for the future of HIV prevention? It feels like a huge step forward.
It is a step forward, but we need to be realistic. There are still hurdles to clear. Regulatory approval is pending, and we need to consider the cost and distribution challenges.
I read that Gilead is working on lowering costs for developing countries. But there are concerns about affordability in middle-income nations, too. And then there's the logistics of getting people those injections every 6 months. It seems like there's a lot to think about beyond the science itself.
Indeed. Access and implementation are crucial aspects that need careful consideration. It's exciting to talk about this new development, but we need to remember this isn't the first breakthrough in HIV prevention. We've come a long way with tools like condoms, male circumcision, and of course, PPP, the daily pills for pre-exposure prophylaxis.
Right, pre-P has been a game changer, especially in places like San Francisco and Sydney, where they've achieved near zero new infections among certain groups. So why the need for a new injectable drug like lenacapavir? Doesn't oral pre-PP already do the job?
It does a good job when taken consistently, but access and adherence have been issues, especially in poorer countries where affordable generics took years to become available. It's not always easy for people to take a daily pill, for various reasons.
I imagine stigma surrounding HIV, access to healthcare, even just the routine of daily medication can be barriers.
Exactly. And those challenges are particularly impactful in sub-Saharan Africa, where HIV prevalence is high, especially among young women. Lenacapavir's 6-month dosing could potentially address some of those adherence issues.
That makes sense. Less frequent dosing could be huge for people who struggle with daily pills. But this reminds me of cabotegravir, another injectable PPP drug that was approved a few years back. Didn't that also offer less frequent injections?
Yes. Cabotegravir requires injections every 2 months. However, it's faced challenges with cost and, surprisingly, limited uptake.
That is surprising. If it's less frequent than daily pills, why hasn't it been more widely adopted? What are people's thoughts on injections versus pills for HIV prevention?
It's complex. Cost is a factor. But there's also hesitancy around injections, even if they're less frequent. Some people may find the idea of injections daunting, while others might struggle with access to healthcare providers who can administer them. Perhaps lenacapavir, with its even longer protection, might shift those perceptions.
It's definitely possible that a longer dosing interval could be more appealing. I read that Gilead is even working on a formulation that could provide a year of protection with a single injection.
Imagine the impact that could have. Easier adherence, potentially wider adoption, and hopefully a significant reduction in new infections. But while these advances are exciting, it's important to acknowledge that the global fight against HIV has hit a plateau in recent years.
So we're not seeing the progress we had hoped for. I know UNAIDS had set ambitious goals for reducing new infections.
Unfortunately, we're far from achieving those targets. The need for new tools like Lenacapavir is more urgent than ever. It's not just about the number of infections, but the lives affected, the stigma, the strain on healthcare systems, and the social and economic consequences. HIV remains a major global health challenge.
It sounds like this new drug represents a glimmer of hope in a fight that has stalled somewhat, but it's clearly just one piece of the puzzle.
It is, and that puzzle includes not just new drugs, but addressing the social, economic, and structural factors that contribute to HIV transmission. Things like poverty, inequality, lack of education, and stigma all play a role.
That's a great point. We can get caught up in the scientific breakthroughs, but the human element is just as crucial.
Absolutely. Science provides the tools, but we need to use them effectively and ensure everyone has access to prevention and treatment. So let's talk about what individuals can do to contribute to the fight against HIV. How can we translate this knowledge into action?
We've covered a lot of ground in this deep dive. The science behind lenacapavir, the complexities of HIV prevention, the ongoing search for a vaccine. Now, I'm curious to hear your thoughts on what individuals can do. What actions can our listeners take to contribute to the fight against HIV?
That's a great question. Scientific advancements are incredibly important, but they are most effective when paired with individual and collective action.
I'm all ears. Where do we even begin?
It starts with knowledge, staying informed about HIV prevention treatment options. And the latest research helps dispel myths and stigma.
Knowledge is power, absolutely. But beyond staying informed, what are some tangible steps people can take?
One of the most important actions is getting tested regularly for HIV. Knowing your status is crucial, both for your own health and for preventing further transmission.
Testing is definitely more accessible now than ever before. Lots of clinics offer rapid testing, and you can even get at-home testing kits. What else can individuals do to protect themselves and others?
Open and honest conversations with partners about sexual health and HIV are essential. Communication is key to making informed decisions together.
Those conversations can be tough to start, but they're so important. By normalizing these discussions, we can help reduce stigma and encourage responsible behavior. And of course, practicing safer sex is vital.
Absolutely. Consistent and correct condom use significantly lowers the risk of HIV transmission. And for those at higher risk, PAP can be a game changer. Talking to a doctor about whether PAP is right for you is a step worth taking.
We've talked about individual actions. What about on a larger scale?
We can all advocate for better access to prevention treatment and support services. This can involve supporting organizations working on the front lines of the HIV epidemic and pushing for policies that promote education, testing, and access to care. These collective efforts can have a ripple effect.
It's empowering to know we can make a difference through both individual choices and by advocating for change.
Exactly. And let's not forget the power of compassion and empathy. Challenging stigma and discrimination against people living with HIV is crucial. Creating a supportive and inclusive environment is essential to fighting this epidemic.
That's a powerful reminder. Everyone has a role to play, whether it's through education, safer practices, getting tested, advocating for change, or simply offering support and understanding. It's a collective effort.
Lenacapavir gives us a lot to be hopeful about in terms of HIV prevention. But it's not a magic solution. It's a powerful tool that works best within a framework of knowledge, responsibility, and social change.
This has been such an insightful deep dive. We've explored the science, the hope, and the ongoing challenges of the fight against HIV. What stands out to me is that even with these amazing scientific advancements, it ultimately comes down to human choices and collective action.
I agree. While lenacapavir represents a significant leap forward, the fight against HIV isn't over. It demands our continued attention, action, and commitment to creating a healthier and more equitable world for everyone.
Thank you for joining us for this deep dive. We hope you found it informative and empowering. Until next time, stay curious and stay engaged.